Hi, I'm Wes with Lantern, and in this video, we're going to dig into codes and standards. Don't run away. We're not going to memorize the book. All we're going to cover is enough to make sure you can navigate the book and you can find answers when you need them. So we're going to talk about two codes in particular in this video. The first one is the ASSE 6000, and this isn't really a code. It's a standard for qualifications related to the medical gas industry. But it's important because a lot of the roles that are defined in this standard you are going to run into as a facility healthcare technician. So ASSE 6000, it's called the Professional Qualification Standard for Medical Gas Systems Personnel. And this is where all of these roles are defined and their qualifications are defined. So 6010 is installer. Anytime you have work done on the medical gas lines in your hospital, the person who is doing that work should be a 6010. 6020 is inspector. That one may end up being closely aligned with the new responsible facility authority role that we'll get into in a minute. 6030 is the other really big one. 6030 is the ASSE qualification for medical gas verifiers. So after your 6010 installer comes in and does work in your facility, the verifier has to come after and make sure everything was installed correctly and that the gases are safe for patients to use. So it's a really critical role. There are others. The list goes on and on. 6040, 15, 35, 55, 6060. The most important ones are the 6010 and the 6030. Those are the guys that you are going to interact with on a weekly basis, most likely, if not daily, in your hospital. So 6010 installer, 6030 verifier. That is the ASSE 6000 series. This is the big one, NFPA 99. Healthcare Facilities Code. This is the 2012 edition. NFPA does release an edition typically every 3 years. The 2012 is still kind of considered the gold standard for primarily the reason that CMS adopted this edition in 2016, and it's now the edition that CMS surveys to. So if you're only going to buy one paperback version, one hard copy, I recommend the 2012. Your state, depending on where your facility is located, your state may have adopted one of the newer editions, but until CMS chooses a new edition, this is still going to be the most important one. A couple things before we get into this. One, further down in this module, we're going to talk about NFPA Link, which is the online access for all of the NFPA codes, and it's pretty slick. If you're a book person and it's easier for you to read it, you can get the book. It is easier to find things online through NFPA Link. And the best part is you don't get to buy it. You just have to pay for it every month. The other thing I will point out is I have this tab set on mine. If you do buy the hard copy, these tabs are worth their weight in gold. That's probably an exaggeration. But they're only like $30 from NFPA. They make it much easier to navigate this book. Super helpful. And they give you a tab for pretty much anything you're going to need to find in the book. So highly recommend that. Okay, so we're just going to talk briefly about how to find things in the NFPA 99 and make sure you know how to navigate this. Chapter 1 is administration. There's not a ton in here that you will need, but there is something important, and that is the code reference is 1.3 is application, and that's an important section, but the really important reference is 1.3.2.3. And that says an existing system that is not in strict compliance with the provisions of this code shall be permitted to be continued in use unless the authority having jurisdiction has determined that such use constitutes a distinct hazard to life. A lot of people in the industry have nicknamed this the grandfather clause. Kind old grandpa that lets you keep doing the bad thing, unless it's really dangerous. So that's an important thing to understand. And basically, it's saying that if you have something in your facility that doesn't meet current code, but it's not a distinct hazard to life, it's not dangerous, you can keep it in place until you renovate. Now that line has changed in newer editions of code. We're not going to get into that in this video, but just know that's one of the things that is changing. In the 2012 edition, that's how it reads. So that's chapter 1. Chapter 2 is reference publications. Super boring. Do not recommend. Chapter 3 is definitions. So if you're wondering about a specific concept, this isn't where to find things in the book. That's in the index. We'll look at that later. This is just very specific terms and phrases and words that are used in this code and what they mean by them. So anesthetizing location is 339. There's some other good ones here. Bathrooms, if you need to know what a bathroom is. In case you're wondering, it's an area including a basin with one or more of the following: a toilet, a tub, or a shower. Demand check, detonation. That's cool. Definition for detonation. So chapter 3 is definitions. Chapter 4 is fundamentals. And if you are on the 2012 edition and you have the same copy I have, that chapter 4 starts on page 25. Fundamentals is important because this is where, in 2012, for the first time, these risk categories are defined. And everything now in the NFPA 99 is based on these risk categories. So they are category 1, 2, 3, and 4. Category 4 means if you have a failure of that system, it's going to have zero impact on patient care. That means that doesn't exist when it comes to medical gas systems because there's always some impact. So we can ignore category 4 and just make sure you are very familiar with categories 1, 2, and 3 because they are significant. And most of you taking this course are going to be at category 1 facilities. So the definition of category 1, facility systems in which failure of such equipment or system is likely to cause major injury or death of patients or caregivers. That's the definition of category 1. So if you lose one of the medical gases unexpectedly, it could be potentially a life-threatening situation. If you have a functional emergency department, if you have ICU, if you have any patients on ventilators, if you have ORs where general anesthesia is being administered, all of these would indicate category 1. Again, if you're taking this course, most likely you work at a category 1 facility, but you can also look at categories 2 and 3 and make sure you're familiar with those. So that's chapter 4. Chapter 5 is the heart and soul of the NFPA 99. So if you get this book, and especially you're newer to medical gas and it's just a ton of information and you're wondering, do I have to read this whole thing? No, you don't. You should read chapter 5 and then you should read it again. And you should pretty much just live in chapter 5 because 90% of what you need to know is going to be in chapter 5. One thing that's really important as you navigate chapter 5 is make sure you understand the way the references work. So as you're looking at your book, the first number of all the code references is going to be the chapter. So when you're in chapter 5, that's going to be the first number. But the 5.1, 5.2, 5.3, that's really important because the second number indicates which category you're in the code book. So in other words, if you want to find out one of the requirements having to do with, ventilation for a manifold, or do you need a simplex or a duplex, or how many alarm panels do you need, and you look at 5.2 or 5.3, the information may not be the same because you're not in category 1. So most of the time, you want to just kind of hang out in 5.1. Just pay attention to those numbers. Make sure you don't get into the wrong section unwittingly. Okay, just a couple more things here. If you are still awake, as we've been talking about this for, 8 minutes, you're doing great. A couple more things. One, anytime you see an asterisk, so for example, I'm on page 32, 513639 is medical air local alarm. And then after that 513639, there's an asterisk. That means back in the back of the book, not the very back, but close to the back, in the section called Annex A, there's going to be additional information. In this edition, Annex A starts on page 125. Annex A is explanatory material. It's not enforceable. It's just helpful notes that tell you more information about the reference that you saw the asterisk at. So if you're in the book and you see a code reference and you see an asterisk, you can go back to Annex A, find that same reference, and it will just give you some more information about whatever that thing is. Another note on that, if you are going to be the person at your hospital who is primarily responsible for the medical gas system, soon that's going to be the RFA. Right now, your facility may not call it that. Maybe you're just the med gas guy or whatever. That's a critical role. I highly recommend you get the handbook of this code, which just gives a lot of extra information. There are color illustrations and helpful notes. Back to the earlier comment about NFPA link, that's still better. So if you're okay with navigating on a computer, it's best to just get that subscription to NFPA link and so much information, and you can search it all very easily. So that's a little bit better. But if you're a book guy and you're the guy primarily responsible for the medical gas system, the handbook is great. Okay. Last thing I will mention is the index, which is at the very back of this book. In mine, it starts on page 197. And the index is just the easiest way to find things quickly. So if you want to know what is a gas cylinder, you can look that up in the index. If you want to know how does the NFPA define flammable liquids, or what do you consider to be a hazard, or what special requirements are there for hyperbaric facilities? All of those things, you can find the term in the index, and it'll give you a list of the code references within the book where you can find information about those things. So the index is a really important way to navigate. Okay, that is the 2012 edition of the NFPA. And again, if you're only going to buy one version, you want to buy the 2012. We're going to talk just very quickly about some of the changes in the more recent editions. So 2012 was the first one published since 2005. There was a longer than usual break in between those two editions, and 2012 was a major revision. 2012 to 2015, not so much. Don't buy the 2015. If you have it, you should probably throw it away and get a different version. It's just not one that is referenced or talked about much. It's not a keeper. 2018, there were a couple significant changes in 2018. One was that all of the dental stuff, which previously had lived in 5.2 and 5.3, was given its own chapter and moved to chapter 15. So a bunch of new requirements related to dental, and a lot of things were clarified. And then just some new technologies were allowed or introduced in the 2018 edition. Corrugated metal medical tubing, CMT, basically like flexible, it looks like hose, but it's pipe, flexible pipe that you can pull off a spool through your facility instead of having to braze in type L or K hard copper. So very interesting new technology that was introduced in the 2018. Oxygen concentrators, that's very rare, but those were introduced in 2018, allowed. And then just some miscellaneous things, vacuum inlet filtration and some other things. So some significant changes in the 2018. 2021, huge change. This is where the Responsible Facility Authority, or RFA, which had only really been hinted about in previous editions, it was in there, but not clear what the role was or what their responsibilities would be. All of that was fleshed out and clarified in the 2021 edition. So major changes. The RFA is going to be, once this edition is adopted, or an edition newer than this is adopted, the RFA is going to be a game changer for the medical gas industry. This is basically a liaison between the hospital and all of the personnel involved in medical gas projects. So the RFA would be employed by the hospital. They may sign affidavits saying that they monitored a 24-hour standing pressure test on new piping. They may say, I inspected this in-wall piping before it was covered up by drywall. They will be the ones to issue a medical gas permit to work, which is going to be a new requirement for anything involving modification of piping. They will be the ones who are responsible for putting together emergency operations plans to prepare for emergency loss of oxygen or other medical gases, maintaining documentation, managing shutdowns. All of these things are going to fall under the jurisdiction of the RFA. So major change, really significant, and it's going to be a good thing. Hospitals should have someone who is able to take that responsibility and own those systems. So that's the RFA. A few other miscellaneous changes in the 2021, but that was the big one. And then 2024, kind of similar to 2015, just not huge changes. Very little between the 21 and the 24. And combined with the fact that CMS has not announced which one they're going to adopt, highly recommend, if you are going to focus on one code book, for now, you focus on the 2012. That's all we're going to share about codes for now. Thanks for watching, and if you stayed awake, great job.